So I'm assuming we're ready to begin now.
We are recording, yes.
Okay, great. I hope everyone is doing well. I'm assuming everybody's about halfway through their semester. I wanted to present something that's basically taken me about 4 years to create, the entire time I've been working with the VERT. And in getting the equipment, it's very obvious how we can use it. But then I have found, and I know several of my colleagues have found, that actual implementing it is a little bit overwhelming. So what I want to focus on is actually talking about creating a master plan for implementing the VERT. So I think everybody at this point probably understands what active learning is, and we want to be able to also describe the benefits of student participation in comprehension and retention, because it's extremely important when we're doing a job that's hands-on for students to take the information we give them didactically, even in labs, back into the clinic. We also want to discover commonalities in content in our curriculum and create material to integrate concepts across the curriculum. So I want to talk a little bit about the equipment. I know some of you have equipment, some of you have recently purchased a VERT, some of you have had it for years, and some of you are in the process of purchasing a VERT. I want to talk a little bit about the importance of positioning the equipment, because it's very key. I actually had to move my equipment from one institution to another, so I really got a good had it positioned one way at my previous facility, and I have it positioned another way. I actually want to have the hand pendant interface as close to the middle of the screen as possible, because how you position the equipment can affect how you interact with the students, how the students interact with each other, and actually comprehension. So when you look at your equipment, even if you have it now, take a look at where your hand pendant interface is, because those cords are only so long, and you can only move around so much. And in order to make it most beneficial for student learning, make sure that the hand pendant interface is positioned in a very good way so the students can interact with each other. Because I actually have the students in labs interacting with each other. If you have somebody at your facility who does human factor engineering, that's really great. I would invite that individual to come into your lab and look at how the students, you and the students interact with the equipment and how the equipment works. And maybe you can get additional insights into how to use the equipment. So when you get the VERT, you first notice a few problems. Obviously, you have a huge learning curve. Most of us are in academic institutions, and I don't get any release time from my didactic courses, because quite frankly, there's no one else to teach my didactic courses. So that in and of itself creates a problem when you're trying to integrate brand spanking new equipment into your curriculum, because the uses of it are so obvious, but implementing, I found, was not so easy. And also data. Virtual supplies everybody with the data set, and I have found that most of my clinics are not willing to share any patient data back anymore. When I first got the equipment 4 years ago, I could get some data, but I cannot anymore. But to work on the learning curve, I just wanted to throw out there, if you just got a VERT or you're going to get one in the near future, play with it a lot before virtual comes to train you, because you want to spend time on learning the things you don't know how to do. Start with small labs. It can be daunting because you can look at so many things to do with it, break things up and start small. And then as you're doing that, you can start breaking down your curriculum and the goal of the assignment that you're going to be doing. And we're going to talk about this a little bit more in just a minute. But I can't stress enough how to start out small, bite off small chunks. If you can get access to a treatment planning system, I have no access to a treatment planning system. I don't have a treatment planning lab. But clinics are willing to do things when they have time for me. I have given them the visible human female and several of the phantoms for them to go and do additional plans for me, such as cranial spinals, SBRT, and I currently have one clinic doing a cyber knife. We're not sure how to pull that data, but I'm going to pull what I can and send it to James, and we'll go from there. Active learning, as we know, is extremely important because those of us who've been in the field pre-IMRT have noticed that the techniques that I trained with pre-IMRT are really not valid for training in today because we're dealing not with geometric volumes, we're dealing more with volumes of irregular shapes a lot more than we were before. And IMRT brought about that paradigm shift in treatment philosophy. The one thing I want to stress is that as students go through the program, I have a 2-year program, and I have also done a 12-month hospital-based certificate program, and even when I did that, the students obviously change from the beginning to the end, and it doesn't matter if you're going 12 or 24 months. So one of the important things is to realize is that how they interact with the information they're given is going to change. We start out with basic stuff, and then every semester we add more and more to that, and you need to look at doing your labs the same way. So when we look at the learning environment that the students are in, one of the things I absolutely love about the VERT is that the students can practice with an actual hand pendant in a safe environment. And as students go through, they go through these 4 stages. And unconscious incompetence, well, they have no idea what they're doing. So first semester, and the VERT is the perfect instrument to improve performance. You know, get exercises to get the students past this stage. Because when they get to conscious incompetence, that's when they have some familiarity with the hand pendant, but they're not real good at it. And we know that that's the point where students become very frustrated in the clinic and therapists get impatient. So this is where learning really begins, when they go from conscious incompetence to conscious incompetence. And the goal of using the VERT, since they're in a safe environment, they don't have to worry about time or pressure or an actual patient on the table. We want to keep the students in a very open frame of mind. The student has to take responsibility and be receptive to learning and improving as well. But the VERT is key to moving the students through these stages, because we all get the student in the clinic who gets comfortable with loading the table up with the patient on it. And then it seems like everything stops at that point because they can do that and they don't want to go any farther, which is not what we want to do, because we really have to understand that students can be very frustrated and use the VERT to this advantage. And keep in mind that one of the important things I find difficult today is critical thinking in the clinic. I get students to critically think when I'm talking to them in labs and when I'm talking to them in a didactic class, but then everything seems to go out the window sometimes when they're in the clinical environment. And so what you can really do with the VERT is help the student develop clinical thinking skills while they're actually in the clinic. And I don't know about other educators, but I find over time that that I have more of a problem with this. And so what you have to realize is that students have three zones: the comfort zone, the learning zone, and the panic zone. And we don't ever want anybody in the panic zone. I can remember the student being in the clinic and being in the panic zone. Anyone in the panic zone is not going to learn anything. And, of course, that's not what we want. The comfort zone goes back to what I was talking about, the student who is wanting to load the table but then not wanting to move on. So use the VERT to your advantage there, because we want to, students have to be pushed past their comfort zone. It's much easier to push students past their comfort zone and into a learning zone in the VERT than in the clinical and clinical environment. So I see some questions coming up. I saw one about can the PowerPoint be available? Yes, we can certainly send that out to everybody. And I also see one about having formalized lab for pendant orientation. Absolutely. That's one of the first things I created. And I even had a student, we were getting ready to do the lab, and she said, oh, wait. And she pulled out, she had taken, I assume it was a piece of styrofoam, and she'd cut it out into the shape of a hand pendant, and then she had taken the picture of the hand pendant, of the actual variant hand pendant, and then had taped it to that so she could practice and memorize where each button was on the hand pendant. So she was actually already looking at getting that muscle memory down. Where's the collimator, where's the gantry, where's the vertical, et cetera, as far as where's the SSD, where's the field type. So by the time she went into the clinic, she was fairly proficient at using the hand pendant, because she would practice on her dummy one at home, and then, of course, we had formalized hand pendant exercise in her as well. So we, excuse me, I'm just getting over a cold. Odd time of year to have a lot of colds going around, but in Kentucky we certainly have. So we know that active learning increases comprehension and retention because it gets the individual engaged with the material. To give you an example of this pre-VERT, I had the students watch a sci-fi TV show where the character Daniel Jackson gets an acute whole-body radiation exposure. It's very interesting because the show gets a lot right. They go through the symptoms, they go through the stages and everything very well. They talk about a lot of what's going to happen to him over a period of time, and then they take some liberties because it is a TV show, and they have to get this done in 45 minutes. The funny thing is the students always had a problem. They rolled their eyes and, oh, gosh, really don't want to do this group project, et cetera, et cetera. But they knew all that. They knew all the material in that without me ever going over it again. They knew that material. So, so doing active learning and using the VERT is very good at getting individuals through this types of things. So the goal with the VERT, of course, is to get the students to retain more, to learn more, and do it. But we have to figure out how to do this. I know a lot of us just use PowerPoint, and sometimes people get a little upset about, can I really give these things up? And yes, because what you can do is you can incorporate them into your VERT exercises, and you can also leave them as is for the students to use as a resource. So I have classes that are 100% VERT. I don't go over any PowerPoints. I have some of it in my material, and I have others that I still have classes that are nothing but PowerPoints. So you're going to have a good mixture no matter what you do. So I really want to talk about integrating the curriculum across the courses, because integrating concepts across courses, because what happens is students tend to compartmentalize. Before they come to us, they are used to leaving math and math, English and English, history and history, and not integrating them across the entire curriculum. The problem for us is it's that everything's incorporated when they go into the clinic. I mean, we can't just talk about radiobiology and pathology and principles and practices and et cetera in each one of those classes. We can't do that. So we want to break down the curriculum. So when we break down the curriculum, there's a few things we need to do. We need to look at course sequencing. And there are a variety of ways to sequence your courses throughout the curriculum, because we have, for example, the ASRT professional curriculum, and how we break that up is, of course, up to us. So I really recommend you look at commonalities among courses, and I also recommend that you look at course curriculum mapping, because most of us have to do curriculum mapping for accreditors, whether it's programmatic or institutional. And when you do curriculum mapping, you can look at concepts that are similar across each course, and you can look at creating virtual presenters that are going to take that across courses. Because when I'm teaching radiobiology, I just don't do VERT labs about radiobiology. When I'm doing physics, I just don't do VERT labs about physics. All of my labs, except for at the beginning when we're teaching them how to do the pendant, we're doing very basic stuff. Once we get past that stage, all of my labs incorporate concepts across the curriculum. Because one of the things we want to think about is, remember we talked about earlier about how the student, how they interact with the material is going to mature and grow and change from the beginning of the program to the end of the program. And to understand how the mind works, we know that we have to have repetition. So when you have continuous repetition, that's when things get into long-term memory. And so we really need to think about, how does our didactic labs, our clinical learning, how does that actually create a functioning entry-level radiation therapist? And I gave a presentation a couple of years ago about improving clinical performance, because everybody needs to get out of the old school C1, do-1, comp-1, because everything has gotten much more sophisticated and complicated past that point. And by using the VERT to integrate concepts across courses is really what's going to make a functioning entry-level radiation therapist. So let's talk about content development for the VERT. So what do you want the student to learn? Are we doing a formalized lab for hand pendant uses? We're just talking about psychomotor skills? Or do we want to talk about treatment philosophy, clinical oncology, skills improvement, remediation, physics, dosimetry? What exactly do you want the student to learn? Because creating your labs is going to be dependent on those types of concepts, what you're actually trying to teach the students. So this is when course sequencing comes in. So create content across the course boundaries because we don't have any in the clinic. And remember those learning zones. Comfort zones where they keep repeating the same thing, but we want to push them past them into the learning zone, but don't push them into the panic zone. So we need to keep those things in mind. And when we bring the curriculum together, as I said earlier, students want to compartmentalize course content, and a lot of times they want to compartmentalize and leave it in that semester and not carry it into the next semester. And that's the good thing about the VERT. So students also don't equate clinical learning with the same effort as didactic learning, and that needs to change as well, because students need to have exercises that are going to pertain to the clinic where they have to read material, integrate material together, and that's why curriculum and content sequencing and looking at concepts across the courses is extremely important now. So when you look at course content and do curriculum mapping, you can use several different ways to map your curriculum. You know, we're used to doing the one for institutional accreditors where you introduce, support, and master certain topics. You also have ones where you can look at for programmatic accreditation where the material falls within the program as well. The reason why I think this is important in developing a plan is because you need to create a master guide of VERT exercises. Now, that doesn't mean you're not creating labs because you've got this equipment. You can't spend 2 years creating this master plan and implementing it. You have to start doing things. But you need to really create a master plan for the VERT, and look at the whole curriculum, because the advantages you're going to get from this is you're going to be able to correlate concepts across courses. So when you look at creating a practice model, for example, this is something I do with first semester students. So basically what they do is we're going to set up something very simple, a 4-field box prostate patient. So here's the objectives for the lab. And I'm going to create this lab so I can use it at various different times. So what happens then is they're going to work on interacting with the patient, and they're going to work on interacting with their partner as well. And it takes a little time to set this lab up, but once you have it set up, I can use this in multiple semesters, and that's what we're going to talk about right now. So basically, the student's going to introduce themselves to the patient and walk them back to the treatment room. So what we do is one student is sitting actually at the VERT console, one's using the hand pendant, and one's getting the patient out of the quote-unquote lobby. So this gets the students working on talking to the patients, and sometimes I actually can get people here at the university to pretend to be a patient. And so they learn how to do these things before they even go into the clinic. So they've learned how to use the hand pendant. Now they're learning how to interact with the patient, and they're learning how to interact with the therapist that's with them. And one thing I want to say, when you look at creating these labs, the instructor key needs to be very descriptive. So anything in red is for the instructor, and of course this isn't put on the student's copy. And the reason why I say this is because I am guilty of creating a lab and at the time understanding exactly what I want to do with that lab, but then when it goes into doing it, I created it maybe 6 months ago, and then I'm not sure what I really wanted to do with some of these things. So be very descriptive in your instructor copy. So here's the virtual presenter for this lab. And you'll notice there's 21 slides, I guess, but you'll notice some of them have the word skip by them. And so what I've done here is I've created a lab where for first semester students where they're going to work on patient interactions and setting up the patient. So one's actually going to pretend to physically set up the patient, one's going to be at the console, and one's going to be working the hand pendant. So this now, when I use it next semester and I go through and do these ones I've skipped, this is going to be a post-test to see how well they learn these concepts. So what we do is I've gone into patient position and I've rolled the patient. So it's on, this is the side that the student who's actually working with the patient is viewing. On the other side, the student has the hand pendant, so they are on their mark. So the student sees this visualization, and I ask the student, how are you going to move the patient? And they have to physically show me how they would rotate the patient. And if they tell me the wrong way, this is the slide I next pull up. And I usually have this on my iPad because I do have an iPad, and so I'm with the students. I'm actually not at the console. But if they tell me the right way because they're supposed to roll the patient halfway, then they get the correct response. So then I'm going to go through and skip those slides. And so what I do is I really love the snippet tool that's on there. And you can go in and snip the presenter, and then you can go in and write anything you want on that, and then the instructor gets that copy. So here's my students that are doing this lab. You can see on the far left, one is sitting, quote unquote, at the treatment console. One of the students has a hand pendant, and the other one's pretending he's rolling the patient. And when the one who is not operating an equipment, they have to talk, they have to take this seriously. It's a real treatment scenario, and they have to talk to the patient like they would in the clinic. And I have to tell you, the students really love this. So when you make your overall plan, you can use previous labs as a post-test to check skills improvements. You can go in and put new concepts from additional courses into that to do at a later time. It can be later in the semester. It can be next semester. So you can create one virtual presenter which you can use over multiple labs courses semesters. And I highly recommend this because what it does is it pulls in concepts from various courses and it gets them to think a holistic approach to learning and not just keeping intro and intro, imaging and imaging, and radiobiology and radiobiology. So when you go through and look at your curriculum mapping, you can look at the content specification from the ARRT, you can look at your goals from your program, you can look at the professional curriculum. You can go through and then sequence your master plan of VERT exercises to increase your skills improvement, correlate related material, and also it shows the students how much they've improved. Because when they can see how stuff was hard previously and now how it's easier, and it bumps them up from that comfort zone to that learning zone where they can really move on. So I just pulled up the first lab I did where I have all the things I skipped, because what I have in here in addition is I've got the dose washes, I have cross-sectional anatomy, and we've not covered those things yet. So in the next semester, you can see where there's no skip on this side. It has, it just has, we're going to go straight through this. And so with the next lab, what you can do is go through and then these are the slides that I don't show the first time I did the lab. So here's the dose wash. So they have to correlate when the patient is rotated, what is it doing to the dose? And we go through and we can discuss these concepts as well after I've done a post-test on how well they interact with patients, because interactions with patient is important, and you can really use the VERT to work on that. One other thing I wanted to mention too is you don't just have to depend on the cross-sectional images that are on that are on the VERT, and you can tell this one's from when the patient is rolled. You can go through, and on the sagittal and coronal images, you can take the snippet tool and go ahead and snip it, and then draw in your own contours as well, so you can have additional views for the students to look at. So when we look at courses, sectional anatomy and oncologic pathology go along pretty well. Physics and radiobiology go along very well because you do things, you talk about anatomy and pathological changes, and then correlating that over to sectional anatomy is very easy to see. And then with physics and radiation biology, I really like to teach these in the same semester. I know everybody doesn't have that luxury, but when they're taught in the same semester, it's really nice because in radiobiology, they learn about the two-step process of photon interaction, and then in physics, then they're going to talk about photon fluence and kerma, and you can relate those together. So basically, I don't have to create, because I want to make my life easier, I don't have to create a separate lab in physics covering kerma and photon fluence, and then another lab in radiation biology, because since I'm correlating material over courses, I can do all that in one lab. So here's an example of how I have my curriculum sequenced. I think it works really well in the first 2 semesters because they get the basic information and then we can build on that. And I can do a lot of labs in the second semester that are post-testing information from the first semester, and I really like that. But I also want to talk about something that people sometimes don't think about. You can use these VERT labs for outcome assessment. And the really great thing about this is you can track improvement when you're doing pre and post testing and then correlating material among courses and then taking them across semesters. And of course, we know accreditors really like that, whether it's institutional or programmatic. One thing I really want to mention is unstructured time. I let the students play with the VERT, and I just say, go play with it and do whatever you want. And they really like doing that. They see the value in it. They start doing things. Sometimes they do mess things up, and it takes me a minute to figure out what on earth they've done. But the benefit is they think of things I don't think. I'm not a student, so I don't totally think like them. But the nice thing is they think of things that I don't think of that we can go and do. And then I want to delineate between student projects and student presentations. When you look at doing things on the VERT. And the reason why I delineate between these two, I'll talk about a little bit in a minute, is because it's important to delineate between projects and presentations. Projects is they're actually using the VERT to solve problems. That's how I define it. And then presentation is they're doing things like a case study. And the clinic portfolio, I know some of you may not do a clinic portfolio, but I want to talk about how you can use the VERT with the clinic portfolio in just a minute. The other thing I like to do is tell the students to get a large binder, and in that binder, I have them keep all of the VERT labs from every course and every semester. We do VERT lab. The VERT's incorporated throughout my entire curriculum in every single course. It's not fully integrated, but and when you look at the sequence of that over time, it's very beneficial to the students. I've already mentioned the first 3 of these, and virtual has created some resources as well. Don't forget about this, because I'm going to tell you I'm terrible. sorry, Jan and Tom, but I'm terrible about forgetting about resources that Virtual has created, and then I go back and look at that, and I go, oh my gosh, I can't believe I forgot about this. They went through the ASRT curriculum, and this is another useful tool, please don't forget about, when you go through and create your master plan for your VERT labs. When you go through and create the labs, don't forget to have a description, objectives, instructor's guide, and I cannot stress, be very detailed with the instructor's guide, because what's obvious to you right now when you're creating this lab may not be so obvious next year when you do it, or if another faculty member does the lab. The instructor guides needs to be set up for ease of comprehension for the instructor and the student, and also think about how you want to use your PowerPoint. So, for example, here's an example. This is a different prostate lab. This is one where students are just learning about treatment volumes and field borders and things like that. I really like to have a detailed virtual presenter where I've done the snippet tool and I've pulled this out. So we have multiple questions going with each one of these slides. So you can see, like number 2 has the second slide, identify anatomy, has questions 2 through 7 on it, and then identify and locate emergency off, questions 10 through 14. The student doesn't see this, but this is for the instructor, so they know exactly where they're at. This is one of the earlier ones I did. What I really like to do now is make sure I have good numbers on each virtual presenter slide. And this is just an example where I want to talk about describing the difference, between 2-field and 4-field setup. And this is make sure you've got good instructions for the instructor, because you never know what you're going to remember in a year. Also look at what skills or knowledge do you want to gain. So when you're going through and creating your master plan over your VERT labs, you need to think about, am I doing the hand pendant? Is this just psychomotor skills? Am I talking about physics concepts? Am I talking about treatment philosophy, or am I doing remediation? You need to understand what you're doing. And again, I really like pre and post testing, and I really like designing labs that are multi-purpose, that I can use them more than once and then use the lab itself as a pre and a post test. And when you go through, do your master plan, keep in mind where the student is at that point in the curriculum sequence and what material they have covered. So here's an example. I talked about using the VERT for outcome assessment. Remember the first lab I talked about where the students work on interacting with patients and with other therapists? Well, here's off my curriculum map where one of my goals, students will communicate. I'll go over, I'll get to the PowerPoint and I'll go through the snippet tool real quickly because it is a fantastic thing to use. Students will communicate effectively with patients, and so you can go through and look here and see where it's introduced. So I can now use some of these labs for outcome assessment. And treatment planning and physics. I do have the physics package with my VERT. I absolutely love. If you don't have it, I highly recommend it because it makes things so much easier for the students. I like to look at I usually don't use the dose wash. I usually use the dose bands because you get the delineation of the dose much better. And when you start talking about field size, I mean, students all know that the field size is defined at the isocenter, et cetera, but then when they get into dosimetry, we start talking about field size a little bit differently, as in it's, the 50%, within the 50% line and make sure we get tumor coverage. And I cannot stress enough the dose bands are very good for that. Treatment planning system compromises because you know when you start talking about treatment planning, the PTV versus the PRV, I like to talk about those types of things, and that is so easy to illustrate on the VERT because you can look at, you know, the planning organs at risk volumes because if those overlap, the treatment planning system can't figure out what to do. So, so it's great for that. I know some people have had some problems thinking about how to incorporate it, so I just wanted to throw up a few things about dosimetry. Beam penumbra at depth, it's a really great exercise. So when we talk about unstructured time, I really like doing this because it allows them to utilize the system, and I let them do everything. One of them will run the VERT workstation, one of them will work with the hand pendant, and one of them can do something else. Allow them to explore it because they will get ideas to give to you to use. And when we talk about student projects, one of my favorites is I tell them they have a kyphotic patient and they have to figure out how they're going to treat it. And that's all I tell them. They're not allowed to ask people in the clinic. And so my students will go through and they'll create on the VERT, they actually create a presentation on the VERT explaining how they would treat a severely kyphotic patient. Now they have to understand how to use the system pretty well to do that, and that's why the unstructured time with it is very good. But then student presentations, you know, case studies, talking about various treatment philosophies, et cetera. We do those a lot as well. Now, I really want to talk a little bit about the portfolio because if you use a clinical portfolio, I hate the word journal and I hate saying journaling, so I always try to think of something different to tell the students, but they really should write, and they should write, not type. Write it with their hand. I know that's hard. I can hardly write anymore myself. But when they have a reflection, when they have a reflection part in their journal, have them talk about tips they got from therapists, what they didn't understand, what was difficult or confusing, and how can the VERT help with the above. Now, the advantages to this is when you show, when you have to show your accreditors, whether they're institutional or programmatic, and also justifying having the equipment in here, when you can show students come back to us and say they're having these problems in the clinic, we've used the VERT to create solutions to these problems now to increase their understanding, that makes a huge impact on your accreditor, whether it's programmatic or institutional. And it took me a while to figure this out, and the students love doing it too because they feel like they have ownership of their education as well. And so in review, I want to say curriculum maps are important, and I'm not saying you have to map out every single thing. You don't, you know, and I kind of go through and look at and pull things from everything, from the contents, the ART content specs, the professional curriculum, and my outcomes assessment plan. Be sure to look at commonalities and content across curriculum. Don't just think I'm just going to make a lab about radiobiology or a lab about physics or dosimetry. Make sure you understand what type of learning experience the exercise should be, remediation, psychomotor, treatment philosophy, concepts, whatever. Create things using pre- and post-testing. Allow students unstructured time. Don't forget the clinic portfolio, the reflective journaling in there. And really create multi-purpose labs spanning semesters because that gets into helping them remember material. And don't be afraid of doing things that are a little unconventional. And so here's my email. I will, Jan has the PowerPoint, and so she can send that out as well. I really wanted to give everybody an idea about how to use, how to create a master plan for the VERT. And what I wanted to do is I want to pull up, I'm just going to try to find a pic here and pull something up and show you. If you go down here to whatever you call this thing, the start button, I guess, and I'm on a PC. So here you have your snipping tool. So if you click on snipping tool, don't worry about this. I mean, because I can go through and even copy on top of that. So now I've snipped this, and if I wanted to write on it, I can. So if I wanted to, so I'm using a mouse to do this, so it's a little bit hard. But this is where I get in and do things like put numbers on virtual presenters when I snip that. But that's a snipping tool. And I'll just show again real quick. Down here to the start, snipping tool. And don't worry if this box is in what you're snipping, because it won't be included. And then you can save this. It'll save as a JPEG. And like I said, I use this a lot. I use this a lot for, let's see if so for example here, I've used it here where I have got, this is off of the VERT. So I've taken this, you can see this is where the field size was being treated. And so this is in my lung cancer virtual presenter. So I put circles here. So potentially, what type of tumor is that going to be? What type of tumor would possibly be in this location? So there's a lot of ways you can use this. Okay, so I'm ready for questions.
I just wanted to say thank you so much, Carol, for your really, really informative presentation. And I think the fact you weren't able to present at the ASRT conference is actually our aim. There is some background noise, actually. I've just muted Cheryl because there is some background noise. You are all unmuted if you'd like to ask questions. Otherwise, you can type them into the chat box. As I explained, I'll send out the PowerPoint in a PDF format with the certificates showing their CE credit, and also just a quick evaluation if you're able to do that. Does anyone have any questions for Carol?
And if you want to look over the material and email me later with some questions, I was also going to send Jan the virtual presenter because I did that on a virtual data set. So I can send her that as well. So she can send that out to everyone as well.
That'd be really helpful.
The virtual presenter that we use over multiple semesters.
That sounds excellent. I do just want to mention as well, just to pick up on your comments from early on about having an overview or practicing straight after you get the system. We do offer a training session for users before they begin using the system, before even the main system arrives, and you can put that onto a laptop. So that should be very helpful. And also I wanted to let people know that if you have questions about VERT, or if you have an idea yourself for a webinar, that you can get in touch with Tom and I, and we'll help you to set it up. So people are saying there's some good ideas from Susan and from Tracy, and saying it's very useful. Does anyone have any questions for Carol? Someone is really typing on the keyboard. I'm just going to try and mute whoever it is. I
appreciate everybody listening. I'm sorry I couldn't be at the ASRT conference. It's a little bit unusual doing a presentation like this. I've never done one before. I realize how much I like to see people and see their smiling or frowning faces, quite obviously. And I want to thank Virtual for doing this WebEx, and thanks to everybody for participating today.
Great, thanks, Carol. If that's it, we'll complete there. But if anyone has got questions, you are obviously able to come back to us. Thanks, Carol, and we'll wrap up there, and I will stop the recording.
Okay, thank you.